Welcome back. This tutorial will explain how to use the advanced editing features available once you've imported your selections from the NANDA International NIC and NOC nursing classifications, the careplans.com master library, or your own personal facility library. You'll notice that the care plan overview area is organized into 3 columns: care plan issues, goals and outcomes, approaches, interventions, and activities. Underneath the column header, there are 2 icons for each individual item that was imported into the care plan. These icons are a magnifying glass and a pencil. Notice that the Options and Edit tab under the Care Plan Issues column is 1 level higher than those that are under the Outcomes and Interventions. To access the advanced editing of the entire care plan problem, you will click on the pencil icon under the Care Plan issue. Before we dive into editing options for problems, goals, and approaches, we'll go into detail about the common tabs that you'll recognize are on each of the advanced editing screens. These common items include the General tab to set whether a care plan issue is active or inactive, and also set critical dates in the care plan like date on set, date review, and date resolved. The First Person tab, if you are using person-centered care plans or person-centered format for care planning, you can enter that dialog in the text below. The Notes tab for any additional notes you'd like to add for any item. The Advisor Note tab, this tab is useful for clinical advisors, care plan consultants, or even educators that are using the Care Plan Builder as a teaching tool. And then finally, the Rationale tab, primarily used by student members that enter rationale for selected diagnosis, intervention, or outcomes that they have chosen. To add text to a selected diagnosis or care plan issue, use the text box located above. By selecting the Goals tab from the primary edit screen, you will be able to view all imported goals. From here you will have several options. You can select one of the goals to edit the specific goal and add other appropriate information. The other 2 options are to add a new blank goal or add an outcome from the nursing outcome classification. These options are located in the left menu. Same concept applies for approaches. By selecting the Approaches tab from the primary edit screen, you'll be able to view all imported approaches, interventions, and activities. From here you'll have the same options. You can select from one of the approaches or interventions and edit that particular approach or intervention. The same 2 options will be available in the left-hand menu column. You can choose to add a new blank approach or add additional interventions and activities from the nursing intervention classification. This wraps up our quick tutorial on some of the advanced editing options in the Care Plan Builder.